everybody. So here I am in my kitchen, and this is the second video for the butterflies. We're going to draw my friend Kelly here, who graciously agreed to be drawn, and my son Matthew, who is my cameraman, will definitely get some credit for this. So right here I have a setup. If you come on over here, Matt, and look at the setup. I've prepared all the things that I need in order to draw Kelly, and I did put a straight needle out, but we know, because this is a butterfly video, that I am going to decide for whatever reason to use a butterfly needle, because that's what we want to learn about today. We know about drawing with a straight needle already. So I have my gauze and my alcohol pads, prep pads. I've got tubes. Kelly needs a PT, a lipid panel, and a CBC today. So I drew my tubes. I pulled my tubes out of the rack, and we're going to use those. I also have some hand sanitizer. I've washed my hands, but I'm going to use a little hand sanitizer in front of my patient. And put my gloves on. So could you just come up to me? So, hi, I'm Shelley, and I'm going to be your phlebotomist today. And can I have your name and date of birth? Don't give me your real date of birth. And so if you could just sit back in the chair and maybe pull your sleeve up, we're going to look at your right arm. So I thought, could you look at me? So I thought about this situation, that it's a little unusual because we're in my kitchen. But then I realized that I've done home draws, and there are a lot of jobs where you actually go into a patient's home and draw blood from them. PT checks, there's insurance companies that hire phlebotomists and MAs to go around and do health checks on people who are applying for health insurance or life insurance. And also nursing homes. A lot of the nursing homes aren't just beds. There's, elderly assisted living where you might go into somebody's little apartment or living room and you'll be drawing them in a chair just like this. So I'm going to show you how that goes, because it's a little different than the clinical setting. So I'm going to get a pillow for Kelly's arm. And now, Matt, if you can just show Kelly's arm. So I'm going to apply the tourniquet and do the draw. You don't have to adjust that. And not unapply the tourniquet like we do sometimes in class, because I don't need to. I'm going to be quick about it. Right here. Now remember, this end of the needle that has the sheath around the sharp goes into the barrel so that it can go up against the tube and make a nice airtight seal for the vacuum system that we use. This side of the needle is the setup is the sharp that goes into the patient. If you remember, I said the side that says BD means bevel up in this setup. So we're going to grab the butterflies, remove the cap carefully, and then Matt, if you can get nice and close to here. As I put the needle into Kelly's arm, you're going to see a flash right down a little bit. You're going to see a flash of blood right here in the needle. So here we go. See that blood flashing? That means I got a good draw in Kelly's arm. So now, Matt, if you can just back up a little bit. Kelly needs a PT. Why do I have two blue tubes for the PT? Because the first tube is going to just push, we're going to use the blood to push the air out of the line. And as soon as we get a flash, or a splash into that tube, we can throw it away. Now that the tube is full of blood, we can fill the next tube, because remember, the blue tube, the PT the APPT, this sodium citrate tube, is the only tube we have that absolutely has to be full. The amount of air that's in that line will make this unusable and rejected by the lab. Order of draw, next would be her chemistry tube. And what's in a chemistry tube? Serum separator gel and clot activator. None of the other tubes are made unusable by the air in the line. Only the PT tube, or the sodium citrate tube. Next in the order of draw, EDTA tube, almost always last. I'm gonna get rid of Kelly's tourniquet now because I know that my last tube is on and I have a good flow of blood. So you can just keep it on here. All right, that's full. I'm gonna get a piece of gauze. And remember, we grab the bottom of this hub to pull the needle out. And then with my pinky, I'm going to grab that line and seal the needle. We're going to keep some good pressure on Kelly because she needed a PT drawn. Not really, but for this purpose. And we're going to make sure that she's not bleeding. A PT would indicate that she was on some sort of a blood thinner or had problems with clotting. So we're going to make sure that she's not bleeding. And she looks pretty good. So we're going to get a nice clean piece of gauze. You can just keep it over here, Matt. And a piece of Coban. So this is Coban. We don't have this in class, but it's a good way to keep pressure on somebody if you don't want to put tape on them. I'm trying to be kind to my friend for volunteering, so I'm using the Coban. And it was actually invented by a vet because it sticks to itself. You can't stick tape on a dog. So a vet invented this so that you can, and then the patient doesn't have a lot of sticky tape on them, and it's a nice, comfortable, and pretty colors. So we get that too. Now, Matt, if you can just show the tubes over here. This is the tube that I got the flash in, or the splash of blood to push all of the blood out of the line. That's trash. I'm just going to throw that out. Here's my PT tube that's completely full because it needs to be. And what are the inversions on a sodium citrate tube? 3 to 4. Here is my chemistry tube. 5 inversions. And my EDTA tube for the CBC, 8 inversions. What are the 5 things I'm going to put on these tubes before I send them to the lab? Patient's name, patient's date of birth, my initials, the date, and military time. So it is 11:20 right now, and it's in the morning, so I would put 1120 as military time. Remember, it's always afternoon, it's plus 12. All right, so that's it for using the butterfly setup. I hope you had a good view of it. Thank you to my helpers, and I'll see you again. And thanks for sticking with me through this, and I hope to see you all in class again soon. Bye.